Hi, we have Dr. Wallace Brownlee and Dr. Waqar Rashid today, who were participating yesterday in a debate about whether aggressive treatment should be used immediately following diagnosis. And just to pick up on that, I want to ask them once again what's their view.
Okay, well, the MS Society asked me to argue against the motion that MS should be treated with not just early treatment but aggressive treatment. And I think one of the most compelling reasons that we shouldn't give everyone with MS an aggressive treatment right up front is that the course that people's MS can take is very variable over time. And I think that if everyone got just the same treatment, then we would end up over-treating people that don't necessarily need that treatment, and exposing them to unnecessary harms. I think a much better position for us to be in would be to understand why some people have a more severe type of MS than others, and personalise and individualise treatments rather than just treat everybody in exactly the same way.
Thank you. What's your position?
Yeah, I actually agree with a large part of that, even though we were on opposite sides the other day. I think we share a lot of common ground. I think that's right. I think it's extremely important to try and identify at the earliest opportunity really who we think potentially has a more severe form or worse form of MS in terms of their likely disability going over time. But I think also we've got to be sometimes a little bit brave in terms of recognising and understanding that the risk of MS from not treating as aggressively as we should, and sometimes we can play a little bit safe in terms of the potential risks of therapy and slightly forget, I think, the potential risks of MS over time as well. So I think, I totally agree with Wallace. I think it's trying to identify the people who we think potentially will do worse and do that at the earliest stage now that we've got the therapy options available, and then to use them appropriately.
So one of the big themes here today seems to be technology. So what do you think is the role that technology should play in sort of this type of decision? What kind of treatment a patient should be put on initially?
I think we need all the help we can get really, and so the use of we've both myself and Wallace Wallace more recently has got a background looking at imaging and imaging technology in MS, and I think as a clinician now, which I've been for a number of recent years, there's a slight frustration in that trying to get the more cutting edge and quantitative imaging techniques actually used in clinical practice and guiding clinical practice. So I think we need to have more of that translation from research and technology in research into everyday clinical practice.
Thank you. Will you add anything to that?
Yeah, well, I think that we've seen lots of technical advances which are exciting. As Waqar said, I'm interested in MRI as well. I think some of the exciting things on MRI are things that we already do that we could do better. I think things like spinal cord MRI and doing contrast-enhanced MRI scans that aren't always done around the time of diagnosis or in the monitoring of MS. I think we can use our existing technology in a better way to both diagnose and treat MS.